How to interpret basic bladder ultrasound images. Imagine you're looking at a picture of the bladder taken with an ultrasound. It might seem complicated at first, but understanding the basics can help you grasp what the images show. Ultrasound is a safe, non-invasive way to look inside the body and check on bladder health. It's often used to find out if there's any problem like tumors, stones, or issues with emptying the bladder properly. When performing a bladder ultrasound, the first step is to get clear images into main views. The sagittal, which is a long vertical slice, and the transverse, which is a cross-section. To do this, the technician places the probe just above the pubic bone. For the sagittal view, the probe's indicator points toward the patient's head, giving a lengthwise picture of the bladder. Then, rotating the probe 90 degrees produces the transverse view, showing a cross-section. These views help visualize the entire bladder shape and size. One of the most important things to look at is the bladder's volume and wall thickness. The bladder should fill with urine, appearing as a dark, fluid-filled space called an anechoic area. If the bladder is overfilled or not emptying well, it might be enlarged, which could suggest retention. The bladder wall should be smooth and thin, usually less than 3 to 5 millimeters when the bladder is full. Thickening of the wall might indicate inflammation, infection, or even a tumor. Next, examine the contents inside the bladder. Normally, the lumen appears dark because of the fluid. But if you see bright or echogenic spots, these could be stones, blood clots, or tumors. It's important to differentiate between real abnormalities and artifacts caused by the ultrasound itself. For example, sediment or debris that moves when the patient changes position is usually harmless, while fixed masses or irregularities might need further investigation. Artifacts are common in ultrasound images. These are false signals caused by the way sound waves bounce or scatter. Slice thickness artifacts or side lobe artifacts can sometimes mimic pathology. Proper probe positioning and patient movement can help reduce these errors, making interpretation more accurate. Another key feature is the ureteral jets, which are the streams of urine entering the bladder from the tubes called ureters. Using color Doppler ultrasound, the technician can see these jets. If they are absent or uneven, it might suggest a blockage or other issues with urine flow. Surrounding structures also matter. In men, the prostate gland is nearby, and in women, the uterus. Recognizing these helps provide context and can reveal if the bladder wall is extending into or pressing against other organs. After the patient urinates, a post-void residual measurement can be taken. This shows how much urine remains in the bladder. A large residual volume might mean the bladder isn't emptying properly, which could be due to an obstruction or weak bladder muscles. In terms of bladder cancer detection, ultrasound can reveal irregularities like focal wall thickening or masses protruding into the bladder lumen. Tumors often look like irregular, bright lesions that disrupt the smooth contour of the bladder wall. Ultrasound can also identify stones and signs of inflammation or infection that might cause similar symptoms. Overall, bladder ultrasound is a valuable tool because it's quick, safe, and doesn't require contrast dyes. It provides real-time images that help doctors evaluate bladder health. But interpretation should always be done by trained healthcare professionals who consider the patient's symptoms and may recommend further tests like cystoscopy or additional imaging for a definitive diagnosis. In summary, reading bladder ultrasound images involves checking the size, wall thickness, contents inside, and the surrounding anatomy. Recognizing artifacts and using Doppler when needed can improve accuracy. Remember, each person is different, and only a healthcare provider can give personalized advice based on these images. Always consult your doctor for proper diagnosis and treatment options.